Good afternoon and thanks for joining us. It's 5 weeks since we set ourselves the target of vaccinating almost 15 million of the most vulnerable people in the country. And the aim was and is clear to everyone by offering the prospect of protection from COVID to everyone 70 and over, to all frontline NHS and care staff, to older care home residents and staff, and to all those who are clinically extremely vulnerable. We can do the most, the fastest, to reduce the incidence of death and serious illness. And with less than a week to go until the target date of Monday the 15th, there's no doubt we have made great strides, with just over 13 million people now vaccinated in our United Kingdom, including 1 in 4 adults in England, over 90% of everyone over 75, and over 90% of eligible residents of care homes for the elderly. But that still leaves nearly 2 million people, a population roughly twice the size of Birmingham, that we still hope to reach. And there are people across the country who, for one reason or another, haven't yet taken up their offer. So now is the moment to do it. Wherever you are, you won't be more than about 10 miles away from a vaccination centre, so go online or get someone to help you, or simply pick up the phone and call 119. And let me appeal particularly to the fantastic social care workers that we all rely on to look after our relatives, our parents, our grandparents. If you haven't received a letter, please contact your employer and fix it up. And let me stress that these vaccines are safe and effective. And it was good to see the World Health Organization today confirm its support for the Oxford-AstraZeneca vaccine for use in everyone over the age of 18 and obviously everyone over 65. And also supporting the 12-week interval between the 2 doses. Indeed, they say the longer interval provides greater protection. And the reason I make this appeal today for people to come forward in those groups and get vaccinated is not so we hit some numerical target, but to save lives, prevent serious illness, and so the whole country can take another step on the long and hard road back to normality. And as the data comes in, I'll be saying more about that, including setting out the roadmap over the next 2 weeks. I think the people of this country absolutely understand the importance of protecting the most vulnerable first, and that's what we are doing. And if we can keep the pace up and keep the supplies of vaccine up, we hope to reach everyone in cohorts 1 to 9 by the end of April. And I want to thank all those involved for their heroic efforts: the doctors, the nurses, military medics, local authorities, transport planners, warehouse operatives, delivery drivers, countless volunteers, often working through the night or even digging out snowed-in vaccination centres, like the community effort at Alwoodley Medical Centre in Leeds last Saturday, so GPs, nurses and their teams could deliver 1,200 doses that day. And I want to thank the millions of people who have received their vaccinations, and with cases still high and the pressure on our NHS still severe, I want finally to thank everyone, all of you who are continuing to follow the rules. And I urge you once again to stay at home, protect the NHS and save lives. Thank you very much. I'm now going to ask Patrick to do the slides.
Yes, thank you. Can I have the first slide, please? This shows the number of people testing positive for COVID-19 in the UK from September through to today, and what you can see is that this peak that we've had in January is now coming down to much lower numbers. Today the number was 13,013 people testing positive, so these are people coming through the testing system, and you can see that there is a good decrease, but numbers still remain high. Next slide, please. A more unbiased way of looking at this is the ONS survey, which takes a sample of people from across England in the community, and what you can see here, and the pinkish line is when restrictions were introduced, the lockdown, and you can see the numbers are coming down, and these are old data because it gets updated every week, and they look backwards a bit, so I'd expect this to come down further when we see the next set of data and come down further again thereafter. So in terms of the number of cases, things are definitely heading in the right direction, and that is trending also, of course, in terms of hospital admissions, which are coming down as well. Next slide, please. And this shows the reduction in the number of people in hospital. So hospital admissions have come down and the number of people in hospital has come down as well. You can see here the dotted line shows the number of people that were in hospital with the first peak, so we're still above the first peak numbers, but it's clearly coming down. And I want to take this opportunity to just say thank you to everybody, because it's because people have stuck to the lockdown rules and the difficult rules that we have to follow in order to get this to come down, that this is reducing in the way that we see. And also, of course, a huge thank you to my friends and colleagues in the NHS for all the enormous work they've done to look after this number of people. So hospital admissions and hospital numbers coming down, and this is also translating into a reduction in deaths. Next slide, please. And you can see here the 7-day average shown in the line, and then the individual days which dot around a bit depending on reporting. But you can see the 7-day average coming down. Again, deaths coming down as hospitalizations come down as well. So all of the numbers are trending in the right direction, coming down quite well because of the effects of the lockdown. And here the deaths are now below the first peak average and coming down, but they've still got a long way to go, and I expect them to take some weeks to come right down. Final slide, please. And as the Prime Minister has said, the vaccination programme is going very well, and over 13 million people have been vaccinated. Thank you.
Thanks very much, Patrick. Let's go to questions from members of the public. Cathy from Huddersfield.
To priority groups in the daily infection figures? If so, by how much? And if not, why not? Thank you.
I think that's an incredibly important question, Cathy. As I told everybody a few weeks ago, this was one of the key things that we were going to be looking at as we make our plans for the roadmap in a couple of weeks' time, and we'll be following the data very closely. But I think I really better go to Patrick for an appreciation of what we're actually seeing so far, because at the moment, although we're seeing reductions in deaths and we're seeing the control of the virus, it seems pretty hard to me to see actual impact of the vaccination program on those numbers yet. But I'm told that we wouldn't be necessarily be seeing it yet. But Patrick, over to you.
Well, it takes 2 or 3 weeks for the effect of the first dose of vaccine to really start kicking in terms of immunity, a little longer, towards 3 weeks, or possibly a little longer in the oldest groups. And then, of course, it takes time for people to catch infections and for that to show up. So it's not surprising that we're not getting all of the data through yet. If you look at Israel, there's beginning to see some data there suggesting quite a significant effect, and we will be able to analyse our data over the next couple of weeks to start seeing the effect. And I think it's important not to keep looking too early, because these are complicated figures to look at. But we would expect to see a reduction, first of all, in severe disease and probably in the deaths and also in infection rates, and that's what we're looking at, and we'll see data, as I say, within the next couple of weeks, I hope.
Thanks very much, Cathy. James from Uxbridge.
With the government expanding the availability of lateral flow tests to businesses with more than 50 employees, are there any plans to use similar schemes to allow for the opening of weddings and other events with a similar number of guests?
Thank you, James. I'm a massive enthusiast for the advantages of lateral flow testing and daily testing. It's getting ever more sophisticated. There are tests that you can do now that don't require you just require a salivary test. They're faster than the ones which involve swab up the nose and so on. But these will really come into their own, I think, as we get the vaccination program really going down the cohorts, and as we start to be able to unlock in the way that I hope to set out in the next couple of weeks. So the answer to your question, James, is we do want eventually, of course, we want weddings and other such events to go ahead as a result of the vaccination, the overall program, and the overall reduction of disease. And lateral flow testing, we think, will be of continuing benefit to businesses and to events of all kinds as an additional safeguard. But Patrick, perhaps you'd like to comment on that one.
Nothing really to add. I mean, I think we need to wait for numbers to come down before we start thinking about how to keep things open and obviously get more vaccinations out. And then lateral flow tests clearly have a place in terms of picking up infections that otherwise you wouldn't detect.
Thank you very much. And Laura Koonsberg, BBC.
Thank you very much, Prime Minister. Should members of the public be booking summer holidays or not, whether at home or abroad? Because the Transport Secretary this morning warned people against booking anything at all. And Sir Patrick, if I may, how concerned are you about the potential of the variant that's been picked up in Bristol, where there have been 14 cases in that city already, and suggestions it might be more transmissible than some of the other variants around?
Thanks, Laura. Well, as you know, as everybody knows, it's currently illegal to go on holiday. That's the state of play at the moment. We're looking at the data every day. On Monday, we'll be able to say a little bit more about where we are in terms of the JCVI 1 to 4 group, and we hope, and where the data is then. And in the week of the 22nd, as I said, we'll be setting out the roadmap, and that is the best I can give. There's not an awful long delay now between now and the 22nd, but I hope that we'll be able to give some more clarity to people then, Laura.
In terms of the variants, we're seeing the same variants or some of the same things in variants popping up all over the world, and that's what you'd expect. There are some variants the virus likes to have because it gives it some sort of advantage, and the advantages that variations may give include increased transmissibility or increased severity, and potentially for some immune differences, which means that the body recognises it differently from an old variant. Those are the three things that one worries about. The common variant that's now in the UK that was first detected in Kent does transmit more and perhaps is more severe, as I've described before, but it doesn't seem to cause enough of an immune shift to worry about that in terms of vaccines. So the vaccines work really well against that. So the first message is that, for all of the mass of the virus out there, it's getting vaccinated, which is important, and making sure that everybody who's eligible to get a vaccine goes out and gets vaccinated. Really critical. The Bristol variant has got one of the changes that the South African variants got as well, and again it's one that the virus likes to try and get, so it's not surprising it's happened, and it will happen elsewhere as well. And in getting that variant, it does make it slightly more likely to look different to the immune system. So we need to watch out for it, we need to measure it, we need to keep on top of it, and need to keep testing the vaccine effects in this situation. But the very key thing, the thing that we have to do is get numbers down. The lower you get numbers, the lower the chance of getting more mutations.
Thank you. Tom Clark, ITV News.
Oh, I didn't answer the question.
Prime Minister, thanks very much. Public Health England has confirmed to us today that what looked like really positive data on vaccine efficacy in the real world in the UK vaccine rollout. Are you encouraged by how well the vaccine appears to be working in that early data? And to Sir Patrick Vallance, if I may, given the great progress we're making on vaccination and the encouraging results, are you becoming concerned that the politicians you advise might be tempted to maybe resist your advice to be very measured and slow in how we lift lockdown restrictions?
Well, thank you very much, Tom. As I think you may guess, there's no one more tempted to be encouraged by data than me. But I've got to be honest with you. I've looked at the data I've seen and scrutinised it with my layman's eye, and so far, as I said in answer to Kathy from Huddersfield, yes, we're getting the numbers down, but can I see results that I think are directly attributable to the rollout of the vaccine? Although I'm assured that will happen soon, Tom, I can't say that I can see them yet, and that's my honest answer at the moment. But it's great that Public Health England have published some encouraging data, but that's how it seems to me at present. But Patrick, again.
Yeah, I just want to wait a bit longer until we see the full data. I mean, we need to get data that comes through that we can really understand, analyse and be sure of what's happening. Say, encouraging results from Israel coming through. The clinical trials are very clear about the efficacy of these vaccines, so you'd expect all this to happen. I think we should wait and look at this properly and not try and second guess as we go along. In terms of the speed of change, it's worth remembering that even with very high vaccine uptake, and it's great to see so many people have come forward and been vaccinated, there's still a large number of people who aren't vaccinated. And there will be a significant number of people in high-risk groups who aren't yet vaccinated because they either haven't had an opportunity to, they can't take it for some other reason, or they haven't come forward. And those people remain at risk. And so it's important that we go cautiously in opening up in order to be able to measure the effects. And one of the things that's really crucial in this is to get enough information to know the trajectory we're on and not jump ahead of it, because we're at very high levels and that can take off very quickly. So I think caution is important as we go into opening things up, and measuring is important, and data is what's going to be important. The virus isn't going to be particularly interested in dates.
Absolutely, and I think what businesses going up and down the country are going to want is a cautious and measured approach that is pragmatic and one that we don't have to retreat from or reverse. Andy Bells, Channel 5 News.
Hello, thank you. Prime Minister, the travel organisation IATA says they've been talking to the government about developing a travel app. Can you confirm if the government's been talking to them about developing this? And is it not quite a good idea to develop an app whereby people's vaccination status, their test status could be recorded, and could that be a way to unlock travel in the summer? And one question to you, Sir Patrick. The Prime Minister says he's a big fan of lateral flow tests. Are you absolutely satisfied that those tests are as good as they need to be to perform the function they're being asked to do now?
Sorry, Andy, on the travel app, we're looking at all sorts of things that we may wish to do in the months ahead. Of course, that's right to do. You'd expect us to be talking to travel firms about all kinds of options, but the top priority now is to drive forward that vaccination programme for everyone, to give everyone that's vulnerable the highest possible level of protection, and then keep on working down the age group so we give everybody in the country the protection that they need or that we can give with the science available to us. And that's the way we want to get back to normality. That's our priority. But when we're in that different world, which I hope will be obviously as soon as possible, then all kinds of apps and all kinds of possibilities will be open to us.
Lateral flow is a really important part of our toolkit, and if you compare lateral flow tests to PCR, you'll get more positives with PCR, because PCR is very, very sensitive. It can pick up very low levels of virus, which may not even be infectious. It may just be low levels there. So PCR will always pick up more than lateral flow. Lateral flow tests are good at picking up people with high viral load who are most infectious. They will pick up, if you use them in situations where you otherwise wouldn't pick up anybody, of course they're useful to pick up the people that you would have missed by definition, because you're not testing. What they're not is 100% guarantee that you haven't got it. And that's important. I mean, they will pick up positives, and that allows you to deal with people who are positive and also allow people to isolate, and they will not guarantee that you haven't got it, but they will reduce substantially the chance. And so they have to be used in the right circumstances, and that's what Public Health England have advised. And I think in those circumstances, they're absolutely the right thing to do.
Yeah, I think the key thing about lateral flow tests is they're going to be part of the mix, and they're already a very important part of the mix. But what they fundamentally are useful at doing is telling you whether you're likely to be infectious much more accurately than they can tell you whether you're actually infected, as it were. So they do have a very clear use case, but it's in conjunction with everything we're doing, and the priority is obviously vaccination. Mikey Smith, The Mirror.
Hi, Prime Minister. A couple of quick ones for you. First of all, you didn't really answer Laura's question about summer holidays, so I thought I'd let you have another go. There's a bit of confusion between your ministers about whether people should book summer holidays. You said fairly recently that you were optimistic about it. Is your family planning to get away this summer, and what's your message for members of the public who are desperate to get away from all this? And secondly, in July last year, government scientists told you that what their prediction of the worst case scenario was for the spread of the virus in the run up to winter. Newly released documents that the government held back for 6 months show they also told you that the worst case scenario was avoidable if you followed their advice. They suggested you not rush to reopen schools and universities, that you not plan to relax rules over Christmas, and that you keep people working from home wherever possible. And in each of those cases, you did not follow that advice, only to reverse course when it made things worse. And by November, before the new variants emerged, we were in the worst case scenario that was predicted in July. 2 weeks ago, you stood on that spot and you told grieving families you'd done everything you could. But don't these documents suggest that that isn't true?
Mikey, first of all, on your question about the summer holidays, I'd really repeat what I said to Laura. I'm afraid it is just too early for people to be certain about what we'll be able to do this summer, and we hope to be able to say more in the week of the 22nd, as I've said, when more data comes in, and more crucial data about the rollout of the vaccine programme and how it's working on us all, Mikey. So I'm afraid I understand why people want to make plans now, but we're just going to have to be a bit more patient. And on your second point, well, there's been scientific advice of all kinds throughout the pandemic. And what I can tell you is that as soon as we became aware of the new variant on the 18th of December, which substantially changed the position, we acted decisively in the way that we did. But there have been scientists who have called for no lockdown, scientists who have called for a complete lockdown throughout. They have been brutally difficult decisions, and we have done our best, as I've said before, to take all our decisions in the interests of public health and protecting the public. Mesa Hall from the Express, who I'm afraid I left out last name. Mesa.
Thank
Mesa, you need to unmute. Thank you.
I'm sorry about that. Can you hear me?
Yes.
Thank you very much, Prime Minister. Sir Patrick, what is the latest scientific evidence saying about the effect of vaccines on people who've already had coronavirus? Does it double up with the antibodies and give you an extra layer of protection? And what would your message be to anyone who might think that I've had the virus, I don't need the jab? And Prime Minister, you talked today in the Commons about booster jabs in the autumn. Does that mean we're going to see the infrastructure, the mass vaccination centres and so on around for some time? And given the concern about new variants, is it possible that some COVID restrictions may have to stay in force until the over 50s have been given that booster jab?
Do you want to go first on antibodies?
Yeah, sure. If you've had coronavirus, we know that most people get antibodies and get some protection from it. Really important to get the vaccine as well. I mean, the vaccine will give another boost on top of that. Highly likely that you get a very good immune response overall in that situation. And so it's not a reason to avoid a vaccination. I'd encourage everybody to come forward for a vaccination.
Mason, we don't see any evidence at the moment to say that the vaccines don't have a beneficial effect against all the variants. So it's likely that all the vaccines have at least some beneficial effect on all variants. But the way we're thinking at the moment, and you'll have heard Jonathan Van Tam say this the other night, is that as new variants appear, it will be more useful than ever to have vaccines that can combat all variants. And yes, I certainly think we need to be getting ready for a world in which we do have booster jabs against new variants in the autumn. But what we want to do, and maybe beyond, and we should start to think about it as a flu jab, something that elderly or vulnerable people make sure they have every year, and I've no doubt that the vaccines will get better and better at being able to cover for all variants. But the plan at the moment is to continue to accelerate the rollout of the present vaccines for all groups, and as I said just now, we're aiming for all JCVI groups 1 to 9 by the end of April. Okay, thank you very much. Wait, we've got one last question from Nigel Praties from Pharmaceutical Journal.
Thank you, Prime Minister. Community pharmacies have been a vital lifeline for patients delivering medication and remaining open to provide health advice and support during the pandemic, and of course, providing COVID vaccinations. But they have yet to see their additional costs during the pandemic reimbursed, and we're seeing hundreds of high street branches closed due to financial problems exacerbated by COVID-19. When are you going to reimburse pharmacies for their additional costs during the pandemic? And how many pharmacies are you happy to see close before the government does anything about it?
Well, Nigel, I don't want to see any pharmacies close. I think pharmacies provide community pharmacies, high street pharmacies provide an absolutely outstanding resource for our country and its healthcare needs. And I'm particularly grateful to pharmacies now for what they're doing as part of the vaccine effort. There are hundreds of pharmacies up and down the country are already distributing vaccines very effectively, and we think that they can play a very important role in helping us to get vaccines into the arms of people who may be harder to reach. We think pharmacies can play a really, really important role. People trust pharmacies, they know where they are, they can find them. The people who work in them, staff are well informed, helpful. It's a very, very good environment to get a lot of good things done to protect the public. So on your point about reimbursement, I will want to make sure that they're reimbursed as soon as possible. They play a vital role in helping us to fight the pandemic and many, many other public health needs. Anything you want to add to that, Patrick? No? Well, thank you all very much. See you next time. Thank you.